Chair, and through to you, to the Deputy Minister. Just to follow along on the line of questioning we were talking about earlier on the homeless shelters in my community in particular, but in the province generally. One last question that I didn't get a chance to ask you about, and I know in the last year we've all been preoccupied, obviously, with COVID. COVID's been a serious challenge for, I'm sure, all departments of the government, and your department has certainly played a major role in addressing a lot of the problems that we've had to face and challenges over the last year in New Brunswick. And I know with special care homes, nursing homes, different facilities, it's hospitals, it's really a challenge. But in those cases, you've got people who have rooms and they have they can be, I guess, quarantined, let's say, and protected. Shelters are a little different. You've got a lot of people who are eating and sleeping in a very confined space, and quite often they're transients. They're moving continually. And I'm wondering if you had. It seems to me, and I know we can't give out information that's confidential, that I do not believe we've had an outbreak in a shelter, and I'm not even sure we've had a case in a shelter. And I'm not asking you to comment on that because I think it's probably privileged information. But I'm wondering what special measures were taken to help the shelters get through the pandemic, to deal with COVID-19 and the residents and the workers alike, I guess, in these facilities, and that they've been, for the most part, it seems very safe so far. And we know in other jurisdictions across Canada, we've heard of outbreaks in shelters, and it's been really a challenge for everybody involved. So I wonder if you could talk about that a little bit, or give us some information on what exactly we have done right here in New Brunswick in helping the shelters deal with COVID.
Thank you very much for the question, Mr. Turner. We often forget about the impact of COVID on our shelters in the province. We talk a lot about our long-term care facilities, but I'm glad you bring up shelters. It has had a significant impact on shelters and the residents living in shelters, where when we've seen zones put into red where the ability to go out publicly has been reduced, shelters who their work was traditionally from evening till the next morning saw themselves having to expand their services to 24 hours a day. So a number of items have been put in place. Regional working teams were put in place to support each of the shelters. The participation within those working teams would see the municipality involved, social development, the shelter itself, public safety, public health, the RHAs overall. Specific measures were put in place to ensure physical distancing within shelters. So down to the physical distance between each one of the beds in the shelter. PPE was provided to staff and to residents by the department. Specific training was provided to staff and residents on the proper use of PPE. There was an adapted prompt model, so in the event there was an outbreak, how would the shelter be supported? So far, we have not had to that in place. Capacity was assessed on each one of the shelters, and originally last spring, in the spring 2020, where we saw concerns over the capacity shelters in Fredericton, education where it came to help us, and we actually had access to using Fredericton High School and the gymnasium to help house some of the people that normally use the shelter. Additional funding has been provided to the shelters for enhanced cleaning, and isolation plans are in place if a resident is showing symptoms, or a resident or a staff person is showing symptoms that they need to be tested. And I do not believe we've had any positive cases in shelters. So now, those isolation plans, sometimes they're on site and sometimes they are an alternate site. But again, those isolation plans are in place.
Thank you very much. Like I say, that sort of wrapped up my questions on the shelters, I guess, in our community, in our province. But I was really concerned about the COVID planning. I not concerned because I hadn't heard of any major outbreaks, so I thought there must have been some planning that's gone into that, and some support, obviously, from your department to the shelters, and it certainly sounds like there has been. So that's great. One of the things we see here in Moncton South a lot right now, and I'm sure it's prevalent throughout the province, is construction of apartment buildings. It seems to be a real boom going on in my community, and I'm sure it's in other communities too, of larger developments. And the one comment you keep hearing from people, are they affordable? Are they affordable? Well, I guess that depends on what somebody's idea of what affordable is, obviously, and everybody's idea is different. But we know the cost of building today, building supplies has escalated tremendously in the last year or two for many different reasons. So it's really made it challenging for developers to build new projects because the cost is so high to put these projects together. But my question for here is, I'm wanting to get more information on, is affordable housing projects in this province. Do we partner with the federal government? Because I know the federal government plays a role in housing and affordable housing. They have a responsibility there. And I'm just wondering, like in 2019, 2020, and even 2021 fiscal years, how many affordable housing projects have we actually partnered with, maybe with the federal government? Can you give us that kind of information?
Thank you, Mr. Turner. I am trying to avoid the urge of talking about economics and the pure issues of supply and demand, because what is interesting is as we build more units, and I'm glad to hear there's multiple units going up in Moncton, because as supply and demand changes, that drives the cost up for all units and really pushes low income even further down and makes it even harder for anyone on low income to be able to afford housing. So the greater the supply, the better it is in terms of cost of housing. In terms of supply in the province, the 10-year action plan, 10-year agreement with the federal government talked for a little over 1,200 new units to be built in the province of New Brunswick. That's to add to the current roughly 14,000 units that we have in operation across the province of New Brunswick, that some are operated by the department, some are the nonprofit sector, and some are private sector that we provide rent subsidies. We have, in the first 3 years of the 10-year plan, the objective is 151 additional units, for which 30 are specifically targeted to homelessness. 20 of those 30 will be, my understanding is, will be prepared for occupancy in June 2021, with the remaining 10 would be available for occupancy in the fall of this year.
Thank you very much. We're going to